Welcome back. I'm Sam from babyREADY. And today we're continuing a conversation about potential interventions and variations in labor. Last time we talked a lot about induction of labor and getting labor started artificially, whether you do it yourself or whether you do it with the assistance of a medical personnel in the facility where you're planning to have your baby. So today we're going to talk about other potential interventions and variations on the labor process. And that's really the kinds of things that can be introduced as you move through the process, as you move towards the birth of your baby. I want to talk about vacuum extraction. And I'll put up an image here so that you can see what a vacuum extractor looks like. The vacuum cup gets placed on the top of the baby's head when the baby's chin is tucked to chest. And then as you push, the care provider, always an obstetrician here, will use what you do to help you maintain how you're pushing, maintain the efficacy of the pushes that you're using. And that will keep the baby from sliding back. So last time I was talking about I was talking about pushing and rocking that baby around the bone and coming out. And using the vacuum helps you to maintain how the baby is placed in your birth canal so that it moves the process along more quickly. It does use some force on the baby's head, but what I want to remind you or let you know is that your care provider has your best interest and your baby's best interest at heart always. They always want a good outcome for you and your baby. And so they're not going to put more strain on the skull than your baby is able to withstand. So they're not going to put an overwhelming amount of exertion. And in fact, they have the vacuum set so that if they have to apply more force than the baby can withstand, the vacuum is designed to come off the baby's head as opposed to allowing them to keep pulling and pulling and pulling. So I want that to alleviate some of your concerns about that. Why is vacuum used? Why are people told that they need to have their babies born with the assistance of a vacuum extractor? Sometimes it's just that you're exhausted. You've pushed and you've pushed and you've pushed, and now your body is done. You're tired. You've had a long labor potentially. A lot has gone on, and you're just not pushing as effectively as you potentially could be. So the idea is, let's help move the process forward. The baby's almost there. We can feel the top of the baby's head very easily by just placing the fingers into the entrance of the vagina, and we can feel that the baby's head's right there, and we can just use some vacuum to help bring the baby around the bone and out. Sometimes it's used as a result of fetal distress. And the only way we can measure how your baby's coping with labor is by using an external fetal monitor or an internal fetal monitor where they put a little clip underneath the skin on the baby's skull to read the baby's heart rate. So we get a consistent read of baby's heart rate to know how your baby's coping with the labor and the pushing as it's unfolding. And if baby's not tolerating all of it well, if you're fully dilated, then your care provider would then choose to use a vacuum to try and get the baby out versus trying to use a cesarean section or forceps or something like that. So vacuum is the first line that they would typically go to help bring the baby out. Those are the two primary reasons. If you're just not progressing with pushing for whatever reason, perhaps you're so frozen with an epidural, and this does happen sometimes, although it's not typical, but how you're seated in the bed and the position that you're in and how your body receives medication, all of those things do bear weight when it comes to being able to feel where you're pushing to be able to effectively move the baby within the bone structure of the pelvis. So that's kind of a quick synopsis of what vacuum extraction looks like. But I will also tell you that if your care provider has said, we need to get this baby out, we need you to birth your child, from the time that decision's made until if using vacuum until the time the baby's born is an extremely short period of time. And so it does happen very quickly once the decision has been made. What can you do? Can you ask questions? Absolutely. Some parents that I've met, or expectant parents that I've met, are absolutely terrified about the idea of vacuum extraction. So take the time to ask questions, even if it's something as simple as, will it be harmful to the baby if we wait? Will it be harmful to me if we wait? Are there alternatives to using a vacuum extractor that may be safer for me or for baby? And why do you think that this is our very best option? Those are your opportunities to ask questions. So please take advantage of those. This is your birth and this is your experience. And you have every right to want things to go the way that works best and safest for you and your baby. But that does not mean that I think you should disregard what your care providers say, but I do believe that you should honor and respect how you are feeling with the process as a whole. So that's vacuum extraction. Now I want to spend a few minutes talking about Forcep extraction. Forceps have a bad reputation. They were used many, many years ago, and a lot of people are afraid of the idea of Forceps based on old stories that they've heard from many, many years ago when Forceps were used in a very different way. Forceps are used as a last resort now in helping to guide the baby's head out for a vaginal birth. Unlike vacuum, forceps are used much less frequently. So vacuum is more likely to be the first line of choice for a care provider if we're having to assist with a vaginal birth. So the forceps are now used as an outlet procedure. The baby's head has to be just at the entrance of the vagina for vacuum or forceps to be an option for you. So the head needs to be very close so that there's not a lot of movement of the baby's body by the mechanical instrument needed. And so this is what forceps look like. The forceps come down around the side of baby's head. Again, baby's head is typically tucked chin to chest, but what forceps can facilitate that a vacuum cannot is a rotation of the baby's head. Because they're rigid and because they're around the side of baby's face, they can actually help to rotate the baby's head if baby's head is not in the right position, if the baby's occipital bone is not facing the birthing parent's anterior or front, so they're not in an occiput anterior position, but instead perhaps they're in a occiput posterior position, where baby's occipital bone is coming against the posterior line, the tailbone, the sacrum of the birthing parent. So it's rigid bone against rigid bone. It can make that more difficult for baby's head to navigate around the pubic bone to come out. And so sometimes, if the birthing parent is struggling getting the baby around that bone, and we're confident that the baby's head is in an occiput posterior position, the forceps can sometimes be used if a manual turning of the head is not possible, to help rotate the baby a little bit within in the pelvis, so that can help facilitate the birth process. It is not uncommon when forceps are used for there to be a need to use an episiotomy to get the forceps into place. And an episiotomy looks much like this. Some of the reasons that episiotomies are used is to make the entrance of the vagina bigger, because the skin is not separating on its own. So you're pushing and pushing and pushing, the baby's meeting the resistance of the pelvic floor for whatever reason at the vaginal introitus, the entrance of the vagina. And that tissue that would normally stretch to accommodate baby's head is not stretching, but it's also not separating or tearing, which nobody ever wants to hear about having happen. But it's not uncommon, and it's very easily repairable. So an episiotomy may be necessary. An episiotomy is not something that happens very often, and I don't want you to necessarily worry about an episiotomy. Some people have asked me before if they should be doing prenatal perineal massage ahead of the birth of their child to help tone the muscle group. And ultimately my basic thought process behind that is that it can't hurt and it might help, so it's probably a good idea. But the very, very best gift you can give yourself is to go and see a pelvic floor physiotherapist in your community and talk to them about the birthing process, how to push a baby out, getting the baby out, and preparing your pelvic floor for the birth of your child. But I do have some information about prenatal perineal massage, and I can put a link to a page about that on my website for your reference. The website again, www.babyready.info, and there are all kinds of resources on the website for your reference. So that's a vacuum, that's forceps, that's episiotomy. Those are 3 potential interventions and variations in the labor process that deviate from you simply going into labor on your own, getting to fully dilated, pushing your baby out of your own accord without any assistance from any medical instruments. Because cesarean birth is such a big topic, I'm going to separate that and put that in a completely separate post. So that's it for today. We'll talk about cesarean section next time. Have a wonderful day, and please don't forget to subscribe to the YouTube channel, the babyREADY YouTube channel. Follow us on Instagram, babyREADY LGBTQ, and we're on Facebook as well at babyREADY. All right, have a great day.